A routine checkup involves standard medical assessments to monitor an individual's health status. Regular medical visits help in the early detection and management of potential health issues. The clinic environment is designed to be calm and reassuring, promoting a positive patient experience. A standard medical test is being conducted, showcasing common medical procedures. The equipment used in the test is designed for routine medical assessments. A heartbeat monitor displays a regular rhythm, indicating a state of normalcy. Brain scan images can reveal potential health risks or areas of concern. Routine brain scans may inadvertently elevate the risk of stroke. The potential stroke risk associated with brain scans is often unknown to patients and healthcare providers. Routine medical screenings, such as CT scans and MRIs, are essential for preventive healthcare. Contrast-enhanced scans use contrast dye to improve image clarity. Contrast dye may introduce certain risks during medical screenings. Contrast dye can temporarily elevate blood pressure within blood vessels. Contrast dye can constrict blood vessels, particularly in older adults or those with pre-existing vascular conditions. Elevated blood pressure and constricted vessels increase the risk of adverse events. Contrast dye-induced elevated blood pressure and vessel constriction can lead to blood clot formation. Blood clot formation may result in a mini-stroke in vulnerable individuals. Caution and careful patient evaluation are necessary before administering contrast-enhanced scans. With age, arteries lose elasticity, becoming stiffer and less flexible. Reduced arterial flexibility impedes blood flow and increases blood pressure. Arterial stiffness increases the risk of cardiovascular complications in seniors. Dehydration reduces blood volume, increasing blood viscosity. When dehydrated, the heart must work harder to pump blood. Decreased blood flow due to dehydration increases risk during medical procedures. Pre-existing conditions like hypertension or atrial fibrillation can increase risks during medical imaging. Contrast dyes, when combined with pre-existing conditions and aging vessels, may lead to adverse events. Dehydration further compounds the risks associated with medical imaging in patients with pre-existing conditions. Documented cases show that some seniors experience TIAs within 24 hours following contrast-enhanced scans. These occurrences of TIAs post-contrast scans, while rare, exhibit a notable pattern. The temporal proximity of contrast-enhanced scans and TIAs in elderly patients warrants further investigation. Contrast-enhanced scans have been linked to an increased risk of transient ischemic attacks, TIAs, in elderly patients. Medical studies have highlighted specific instances where contrast agents correlate with adverse neurological events in older individuals. Statistical data indicates a significant correlation between contrast-enhanced imaging and the occurrence of TIAs among the geriatric population. A transient ischemic attack, TIA, can occur following medical procedures, such as contrast-enhanced scans. Patient testimony highlights the importance of understanding potential risks and benefits before undergoing medical procedures. Understanding the recovery process from a TIA is crucial for managing patient expectations and promoting rehabilitation. When a contrast scan is recommended, it is important to determine if contrast is absolutely necessary for diagnostic purposes. Alternative imaging methods that do not require contrast should be explored to minimize potential risks. Minimizing risk is a key consideration when selecting a diagnostic imaging method for seniors. Adequate hydration is crucial before and after a contrast scan to support kidney function. Seniors should drink plenty of fluids to help their kidneys process and eliminate the contrast dye. Maintaining hydration reduces the risk of kidney damage associated with contrast dye. Prior to contrast scans, seniors should request kidney function tests. Kidney function tests assess baseline renal health, identifying pre-existing issues. Identifying pre-existing kidney issues allows for tailored preventative strategies against contrast-induced nephropathy. Heart stress tests can impact brain health due to induced physiological stress. Stress tests can affect cerebral blood flow and neural activity. Monitoring and managing these effects are crucial to minimize adverse impacts on cognitive function. Overuse of X-rays can pose risks to brain health due to radiation exposure. Excessive X-ray exposure can lead to cellular damage and potential long-term cognitive effects. Balancing diagnostic benefits with radiation risks is essential when using X-rays. Medications prescribed for unrelated health issues can have unintended side effects on brain function. These medications may affect neurotransmitter balance or cerebral metabolism, leading to cognitive impairment or neurological symptoms. Awareness of potential drug interactions and side effects is vital for preserving brain health. Routine tests are valuable tools for maintaining brain health. These tests enable early detection of potential brain health issues. The effectiveness of routine tests depends on appropriate usage and informed decision-making. Open discussions with doctors are essential to determine the necessity and suitability of specific tests. Inquiring about the benefits and limitations of each test ensures informed healthcare decisions. Understanding individual health profiles is crucial for selecting appropriate medical tests. Proactive engagement in healthcare, including regular checkups, is crucial for maintaining optimal brain health. Informed discussions with healthcare providers empower individuals to make educated decisions about their care. Taking control of one's well-being through informed healthcare decisions contributes to overall brain health.